Okay, so this is going to be our blood trace starting from the testes or a single testicle to the descending colon. So if we start down here near the testes, you can start on either the left or the right. We'll start here on the left. You see that it is covered in this fascia, this spermatic fascia, which is just this connective tissue covering. In order to see the first blood vessel that we're going to start with, we're going to hide that. And what we see here is this interwoven network of vessels here called the tympaniform plexus of veins. Okay, this is essentially the very distal or the very beginning aspect. If you're talking about starting from the testes, this is the very beginning as we work our way back towards the heart. And so we can see it highlighted here. If we click here, we can continue to follow it. Here, this is going to be the gonadal artery. So specifically in males, we're going to call it the testicular vein, the gonadal vein, and in females, it would be the ovarian vein. But if we follow this up, we can see it's still highlighted here. We can see it highlighted here. We can continue up, and we can see it draining into this renal vein. Now, it is asymmetrical, the drainage of the left testicle and the right testicle. On this left one, the gonadal vein here, this testicular vein, drains directly into the left renal vein. Now, the right one, if we go down here and we start over and we do this again, and we hide this, it is going to go not into the right renal vein, but rather into the inferior vena cava directly. So here we can see the same tympaniform plexus of veins, the same starting point. If we go up and we start here, we can continue to follow it. And whenever we follow this structure upward, we can continue to follow it as it's highlighted. And we can see right here, it drains directly into the inferior vena cava, okay, as opposed to the renal vein that would be right here, okay. So the right gonadal vein drains into the inferior vena cava directly, and the left one will drain directly into our renal vein. Okay, so it is asymmetrical. So make sure you are aware of this difference and understand this difference, whether you're talking about the left gonad or the right gonad, whether you're talking about males or females. But once we get to the either the renal vein or directly into the inferior vena cava, we're at the IVC. So we're going to work our way up. Here you can see the base of the IVC. And then that will drain deoxygenated blood into our right atrium. From our right atrium, we go through the tricuspid valve into the right ventricle. From the right ventricle, we go up and out into the pulmonary semilunar valve. From here, we enter into our pulmonary trunk, and then our left and right pulmonary artery. So there's a left, and here is a right. And then coming back, we're going to come in through our pulmonary veins. So here is left pulmonary vein, here are right pulmonary veins, and both of those will drain into our left atrium, right? And so I'm going to hide our venous side now, and I'm going to highlight our arterial side, and I'm going to get us back into the heart view here. And so from our left atrium, we know that we go through our mitral valve here. So if I hide this rib, we go into our mitral valve or through it, or our bicuspid valve into our left ventricle. From our left ventricle, we go up and out of this other valve, the aortic valve or the aortic semilunar valve, into our aorta, right? So here's some perspective here. We're in the ascending aorta. We then go to the aortic arch, and then from there we begin our descent in the descending thoracic aorta first. We continue inferiorly to our descending abdominal aorta, and I'll add the bone back for context. And now if we're going to our descending colon, first we need to look in anatomical position, where is our descending colon? Well, we know that on the individual's left, this is going to be our ascending colon here. We'll go transverse, and then we will go to descending. And the descending colon is part of a group of structures called the hindgut. And so the hindgut is supplied oxygenated blood by the inferior mesenteric artery. So if we know that, we can follow our abdominal aorta down until we get to our inferior mesenteric artery. We know that this is our celiac trunk here. This is our superior mesenteric. And so in order to find your superior mesenteric, just look right beneath that, and if we look right under here, we can see our inferior mesenteric artery here. Now, there are lots of different branches off of the inferior mesenteric artery, but the main one that we're going to see that supplies blood to our descending colon here is going to be our left colic artery, and we can see that right here. If I click on this one here, here's our left colic artery, and then as you just saw, it branches into lots of little marginal arteries, but it's this left colic artery that is a branch off of our inferior mesenteric artery, or our IMA, that is supplying the majority of our descending colon here with oxygenated blood. So that is the walkthrough and the blood trace from a single gonad to the descending colon.